Hi, my name is Amy and this is my catheterization video. What I'm going to need is some hand sanitizer for my hand hygiene, some plain gloves, a washcloth with a basin of warm water and soap, and my catheterization kit. And to start off with, I will verify the provider's orders and then head to the room, close the curtain door, and to give my patient privacy and introduce myself. My name is Amy. I'm going to be doing your catheterization today and get the patient's name and date of birth. Can I get your name and date of birth? And from here, I'm going to go ahead and perform my hand hygiene. And I'm going to explain to the patient the procedure today. So we're going to be doing a catheterization. So we'll be inserting a small tube into your meatus to drain out the urine and kind of help relieve the distension of your bladder. It's a pretty common procedure. We use it on patients that are usually incontinence or had injury or trauma or surgery in that area. Perfect. So let me turn this, and this is my patient, and I'm going to make sure they're laying in a supine position with their knees slightly bent out. In this case, I'm kind of bending out more so I have more room, and fixing that. And I want to make sure I cover them as much as possible for their dignity. And I'll start by cleaning this. So I'll start off with warm water and swiping front to back. And then I want to make sure I do the other side and make sure that I don't use the same part. Perfect. And while we're doing this, I'm going to inspect and find the meatus. Perfect. Now I'm going to go ahead and open the catheter kit. So I'll have you keep your legs out. And this is a sterile procedure, so we want to make sure that we don't touch anything. So we'll remove these and do our hand sanitizer again. And open up our catheter kit. And we want to make sure to not go over the sterile field. And we'll open the gloves and start with going in. And grab them. Okay. And And then I'll grab my glove, and I want to be very careful touching it and just touch the outside of the inner outside sleeve. Pull that on and go under the other one and slide that on my other hand. And technically these would be the different hands, so I'd go under more. So I kind of changed that wrong. Okay, and make sure this is over my cuffs. And we can remove that. Now we have our drapes, so I'm going to take the very first drape, and it's sterile, so we want to just make sure that we put the shiny side down and try to just touch the outer edges to maintain the sterile field. Perfect. And here is another one, but this is a fenestrated drape, so this will actually put right over the vagina. And the vagina will go in the hole, like so. Perfect. I'm going to just move that so you can see. And I'm just letting my patient know kind of what we're doing. I'm going to go ahead and put this tray right in the middle between your legs. And it's important that we start with getting our catheter set up. So I'm going to grab my cup out and pull out my catheter. And this is a Foley Catheter. So however we need to, we just want to make sure this end stays sterile and stays in the sterile field. So I'm going to go ahead and start off with opening my lubricant. Perfect. And inserting my catheter, and I kind of just hold a few inches behind because you don't want to be too close to where we're going to insert it. And just kind of dip and get that ready. We want to make sure our tubing doesn't fly across the room, which is slightly difficult. Perfect. And I'm going to open this up while my hands are still sterile. Set that down. Okay, and then I'm going to let the patient know I'm going to start off by cleaning the vagina. So I'll open up my 3 swabs. So put those down. Trash that. And with my first swab, I'm going to go into the right inner labia. And then on the second swab, I'm going to go in the left inner labia, and I'm going to make sure I throw those away and not back on the sterile field because they're no longer sterile. And then right in the middle. And you only want to do 1 pass each time. And now I'm going to explain to the patient that we're going to insert the small tube to help with the urinary distension. And we're only going to be inserting about 2 inches or so. So we'll grab our catheter and holding it again, we'll just, and with my non-dominant hand, I can open up the vagina and tell my patient that they may feel like a burning, stinging, some discomfort. So just breathe and relax as much as possible and bear down if needed. And then I'll just insert that into the meatus about 2 inches and hopefully find a flash of urine. And I would want to just make sure that my catheter is locked or hooked to the bag so it doesn't go everywhere. Perfect. So now that this hand is no longer sterile and this is my only sterile hand, I am going to grab my solution that goes into the balloon, and I'm going to just put that right on to the end. Oops, maybe. And it's kind of hard because I've been playing around with this kit and I'm kind of getting lube everywhere. So everything keeps slipping. Okay, and I'm just going to slowly push, letting them know they may feel some burning and let me know if they're having any pain. And I'm going to slowly fill that balloon. Perfect. And release that. And we're just going to pull just a little bit, just a little tug, like nothing crazy. You don't want to hurt them. And just make sure that it's in there. Perfect. And go ahead and clean up. And make sure my patient's comfortable. If need be, I can collect some urine in the cup. And there is a label for my catheter that I want to put on there to write my name, when we placed it, and all the information. And just clean up my patient. Move all these. Cut that off. And attach the catheter to the leg or the side of the bed with avoiding the rails that go up and down. And recover my patient. And perform my hand hygiene again. And document my procedure. Thank you.